Welcome, and thank you for taking the time to learn more about the VA Pharmacogenomics program. We've developed a series of short educational videos about pharmacogenomics, or PGx testing, at the VA. We invite you to view one or more of them to inform the use and application of PGx testing. In this video, we summarize how to apply PGx test results to patient care and resources available to support PGx care. The PGx report provides an in-depth interpretation that's useful in application to patient care. PGx results can be integrated within the current patient care process and can be applied to existing prescriptions. The PGx lab results report identifies drug-gene interactions. However, this interpretation only takes the pharmacogenomics results into account at the point in time of testing and does not include any patient-specific or VA-specific factors that are important to medical decision-making. For example, other medications such as drug-drug interactions the patient may be taking are not accounted for. Additionally, other patient-related or VA-related factors are not included in the interpretation. Therefore, the provider remains the most important player in discerning to what extent PGx results are clinically actionable, since they are only one piece of the puzzle. When deciding between which type or dose of medication to prescribe, a provider may conclude that other factors are more compelling than the patient's PGx test results. There is no problem with making a decision that is not in agreement with PGx recommendations. It is recommended, if this is the case, that documentation of the clinical decision-making process is in the medical record. The information in the PGx results report can be used to review your patient's list of existing prescriptions, so you may determine if any interactions apply. Should a drug-gene interaction be identified for your patient, it can be evaluated in the context of the patient's individual clinical circumstances. That is, other medications, diseases, organ dysfunction, etc., and their current response to that medication, if they're already taking the medicine. If the response cannot be determined or is in question, then consideration of a change in medication may be needed. If, however, the patient is taking the medication and responding appropriately, for instance, the medication is effective and not toxic, then there is no need to modify the prescription. In all cases, indication or patient-specific factors may be a higher priority than mitigating a drug-gene interaction risk. In this scenario, the provider may exercise their clinical judgment and choose to override the application of the PGx-based recommendations. To support your PGx practice, the VA PGx program has developed additional tools that we hope you find helpful. In CPRS, the Active Clinical Decision Support, CDS applications, that is, alerts, are called Clinical Reminder Order Checks, CROCs, and have been developed for the drug-gene pairs that the VA PGx panel informs. Clinical Decision Support for Cerner is under development. Prescription orders may be impacted by a drug-gene interaction. A provider would become aware of this through CROCs or a manual review of the pharmacogenomic report. CROCs are available as interruptive alerts that fire when a prescription order is placed and a drug-gene interaction is detected. The alert provides information on what medicines are affected, the drug-gene problem, action that can be taken to mitigate risk, rationale, and resources for further information. Alternatively, a provider may choose to manually review the pharmacogenomic report and note whether the drug they want to prescribe is highlighted within the yellow precaution column. As in the case with existing medications, PGx data are one piece of a puzzle to be taken into consideration with all of the patient's clinical characteristics before action. If your facility does not have a local pharmacogenomics consult service, an Interfacility Consult service, or IFC, is available to providers. If, after an evaluation of the PGx results in the context of a veteran's care, clinical questions remain, providers can order an IFC. Questions may include, is my patient's side effect related to a drug-gene interaction? Or, is my patient taking any medication that would alter the way their body is predicted by PGx to respond to medication? This consult order will route to a PGx-trained pharmacist who provides electronic teleconsultation for any participating VA PGx site. To access this service, search for the IFC Pharmacogenomics e-consult template complete the pre-specified form, and submit an order. Direct-to-veteran pharmacogenomics care services are available via the National Telepharmacogenomics Service. These services include a pharmacogenomics-trained pharmacist who is available to provide direct-to-veteran pharmacogenomics care such as education, comprehensive medication management, and reactive testing integration, among other services. The VA PGx SharePoint hosts many helpful resources as well. The Provider Quick Guide offers big-picture information on the VA PGx program. In addition, a medication reference is available that lists information by drug, such as the implementation status of active clinical decision support tools, relevant genes, a summary of relevant drug-gene interactions, links to published guidelines, educational videos explaining the science behind each drug-gene interaction, and annotations of PGx-related information found in the drug label. Thank you for your time and attention throughout this video. We hope you found this information to be of value to you and your clinic. Should you have any questions and/or feedback about this video or the VA PGx program in general, please refer to our website or contact your local site champion.